Hello and welcome to this year's virtual Parkinson's policy event. I'm Congressman Gus Bilirakis. In addition to representing Florida's 12th Congressional District, I'm the lead Republican on the Consumer Protection and Commerce Subcommittee and a member of the full Committee on Energy and Commerce, the Health Subcommittee, and the Communications and Technology Subcommittee. I'm also the co-chair of the Congressional Caucus on Parkinson's disease. For me, this work is very personal because I have close family members and friends who suffer with Parkinson's disease. I know the cost both in financial terms, but also the human toll that battling a complex disease inflicts upon the patients and his or her loved ones. I also do a lot of work on the Rare Disease Caucus. I'm the co-chair of the Rare Disease Caucus. For both complex diseases and rare diseases, drug development, as you know, continues to be a challenge. Like rare conditions, drug development for complex disorders are expensive and financially risky, so they tend not to attract as much interest from the pharmaceutical industry and the biotech industry. There are more common disorders that they focus on. So this means we have to continue streamlining the FDA process, and we made a great deal of progress, and incentivizing investment for those who are willing to work for the development of cures and treatments for these diseases. This is something that I've been working on for quite some time. I'm very passionate about this. I also believe we have to continue to increase federal investment in research through the NIH, CDC, and the Department of Defense for Parkinson's disease. We're making progress on that front. And the NIH just received a research funding increase for the 5th year in a row. Very pleased about that. A 7% increase and up to $42.9 billion. And from the 2016 to 2019 years, funding for Parkinson's research has increased by 40%. Access to care and support services for Parkinson's patients continues to be a huge priority. All, again, throughout Congress, so it's not a partisan issue. We've seen tremendous progress in expanding telehealth options as well during the pandemic. For example, CMS has recently announced it added deep brain stimulation programming to its approved list of telehealth services throughout the public health emergency. We need to ensure this vital resource remains in place once the pandemic is over, and we'll focus on that. And of course, access to affordable prescription drugs remains a priority for all Americans, but even more so for patients with complex medical conditions like Parkinson's. I've been a strong supporter of reducing prescription drug costs, believing that no option should be off the table, for consideration when talking about how to achieve such an important goal, reducing the price of prescription drugs. There's no silver bullet when it comes to reducing the cost of prescription drugs, but as part of the solution, my bipartisan lower drug costs through Competition Act was signed into law in 2017. It is an example of a private market solution to this challenge, offering an expedited FDA approval process for the development of generic alternatives to a drug when no competition was in place on the market. Makes sense, right? Since being signed into law, 75 drugs have been granted FDA approval under this expedited process and resulted in lower cost alternatives. We need to continue to build upon this success. The National Neurological Conditions Surveillance System at the CDC secured funding to continue collecting nationwide data to help increase understanding of neurological diseases, most recently through a pilot project focusing on Parkinson's and MS. This should be very helpful. Additionally, I'm also in the process of developing the Speeding Therapy Access Today, or the STAT Act, to enact targeted impactful, and attainable policy reforms at FDA to accelerate development of therapies across the spectrum of rare diseases and disorders and facilitate patient access to these therapies. The STAT Act will improve access to therapies for the rare disease community, including patients living with an ultra-rare disease, by promoting better intergovernmental coordination and advancing science-based regulatory policies through the establishment of a Center of Excellence for Rare Diseases and Conditions, in addition to ensuring the intended patient populations ultimately receive access to approved therapies. It really makes a lot of sense, streamlining the process. Well, I'd love to be greeting you in person, as I said, and most years I do. I understand that this virtual experience improves safety for everyone. It is an honor to send you this message today, but also to have the chance to thank you for your strong advocacy. You are making a difference. Lawmakers meet with many people each day, but I have found that it is the personal, individual stories that truly make the biggest impact. Sharing the challenges that you and or your loved ones face due to Parkinson's disease can it'll help garner much needed support for the legislative challenges we as a community are hoping to make. So thank you for getting outside your comfort zone and educating your elected officials about how Congress can make a difference, a positive difference, in the lives of those living with Parkinson's. I know you will do great work. I know that. And again, we're in this battle together, as I have many. I have relatives, close relatives, that suffer from Parkinson's disease, but they're struggling, but they're getting through it and living normal lives. So again, thank you for participating, and I look forward to meeting with you again in person real soon. God bless.